My vision for the Minority Education Institution Initiative really came about because I knew that our young people could really contribute to preventing and reducing HIV/AIDS. And oftentimes we think we can talk to young people and we think that we can tell them this is a one-on-one conversation or always going in one direction. But I really recognize that young people are some of the best teachers of each other.
When this project was first granted to MEI Tribal College, there's a core of elders that are the non-elected leaders of a reservation, and they opposed this grant. The university liaison with the students, he was able to talk with the elders, and then by being able to show them some data and some statistics that nationwide, this could be a problem for the reservation, and that, that by having the information about HIV would help prepare them if an epidemic hit the reservation. And so that the more information they had, the better prepared they would be for the future.
The first thing we had to do was to actually document that this particular population, ages 18 to 29, are underserved. When you're looking at tribal colleges and universities, there's really no single point of federal funding that address specifically substance abuse and HIV prevention services.
We have a certain total number of folks living with HIV who are Native identified. However, the estimates are actually double that. Issues of poor surveillance actually are on the federal level, on the national level, and that's national data collection systems, whether it's through the CDC, Indian Health Services, or other national reporting data systems. It's really hard to capture what's what. When we talk about HIV, I always say you can't do this work unless, you have to be willing to talk about homosexuality, sex work, incarceration, injection drug use. In the cultural considerations, homophobia and stigma are certainly pervasive, and I sort of tie that back to colonization.
With initiatives like MEI for our tribal colleges and universities, to be engaged in a positive movement that can heal our communities, that can provide education, that can help restore the balance, that there's only good that can come out of that for our indigenous nations, I believe.
When we put on events, we generally have an incentive, and a lot of the times we work with our tribal health department and offer double incentives. So we get people coming in for HIV, Hep C, and chlamydia testing at the same time. We also just offer, I think it's the comfort that we're there for them to talk to, and we are non-judgmental, and we're their age half the time. So it's really kind of a personal experience for both of us, and I think it makes it really successful in that sense.
The reason why I'm committed to the young adults on college campuses is because I spent many years in leadership positions on a college campus, and I see the potential for our young people. And I see that by some young people not having the information they need by some of the choices, it puts them in positions of becoming less than they could be. So I really find it to be important, added with the high percentages of use rates and problems related to alcohol and substance abuse. I know that we can make a difference.
The Minority Education Institution Initiative, or MEI, was funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA.